through the news. So, to the chagrin of many, the Centers for Disease Control has basically changed their policy. Early on, a couple of months ago, they had the policy that people who are vaccinated can now walk into places without wearing a mask. And I thought this was utterly ridiculous on some level. Not ridiculous, but more so, the vaccine or the virus hadn't gone anywhere. It was somewhat of a political decision. And I said months ago, 6, 7, or 8 months ago, that we were going to hit the point where there were going to be this, let's say, depowering of Fauci and the empowering of the political space. When you don't have 5,000 people dying a day, at that point it becomes a political choice of, okay, when do we open things back up? When do we tell everybody that things are great, they could go about their life, etc.? Mission accomplished is exactly what Joe Biden wanted to give. Wasn't there yet where he could give it, but you did have to get to the point of getting people out and at 'em. And not just out and at 'em, more importantly, vaccinated. The idea of opening up the public had more to do with, look, if you get a vaccine, you can go into stores now. You can hang out with your family members. Isn't that something that you want? And unfortunately, it seemed that that is really only appealing to a small percentage of the population that was basically against the vaccine. The people who wanted to get the vaccine went out to get it. The rest of them who were skeptical, who were dodgy about it, basically the Republicans or the youth, and basically youthful Republicans at that, they were against it. And so you got, 48% of the public, they got vaccinated. The numbers went up pretty quickly because those people wanted and intended to get one. So the 90% that wanted and intended one got one. Numbers went up. The administration, people patting themselves on the back. This is over with. We're good. Oh my God. We've been stuck at 48% for like a month. We hit 49%. And it's not budging. And you have a large component of people who don't want to get the vaccine for various reasons. Some are just unempathetic. Some don't give a shit about anybody else but themselves. Some are skeptical about the vaccine in and of itself. Some don't think COVID is a big deal. Some have listened to the president with this notion that COVID isn't a big deal. He can use, bleach or whatever to deal with it. And some of those people, a lot of those people have dropped dead because the majority of the people, 99%, that are dying in the United States from COVID are the unvaccinated. And they've honed in to the Republican Party and the anti-vaxxer message that basically the Republican Party has been pushing for entirely political reasons. Even those people who've gotten vaccinated have still come out attacking vaccinations. And yes, I'm talking about Fox News. I'm not even going into the OAN and some of the other Newsmax nonsense. I'm just talking about the main network itself. Safe space for anti-vaxxers. And basically murdering their audience. And that's not just with the vaccines, that's with masks. That was with the recommendations about distancing. They were against all of it, all the way through, almost entirely. In some respects, especially after Trump left for political reasons. But even during the Trump administration, basically backing Trump up in that nonsense on some level. Going so far as they got concerned about lawsuits because of the stuff that the Pillow guy and Trump were pushing. Well, that was about the election malfeasance. But when you get into the whole thing about the vaccine stuff, Donald Trump should have been more gung-ho about pushing his people for the vaccine, since Donald Trump himself was the person, supposedly, Operation Warp Speed, despite not having anything to do with the vaccines. This message is a whiplash. This message means that things have gone wrong. For the CDC to have changed their guidance, this means that something has gone monstrously wrong. The thing that has gone monstrously wrong, like I said, is this. 7-day average, 61,976. 64.1% increase from the previous week. A 439.7% increase from the lowest averages in June. So you go from 1 month, things looking okay. Another month, things looking okay. You get 2 months out, things are monstrously wrong. They've gone monstrously wrong. And they've gone that way for several weeks now. You also have, just from the basic numbers of it all, 108,000 new COVID cases were reported in the United States yesterday, 406 new deaths. Over the past week, 63,248 cases, and that is 145% from the average 2 weeks earlier. This is not good. This means something has gone wrong. And yes, you can point to the safe space anti-vaxxer networks like Fox News, OAN, or whatever the Republicans are saying. You can do that. Fair enough. But at the end of the day, regardless of those people that were politically against, basically people who were pushing for death of the American population for their political ends, despite that, you and your administration still had a certain responsibility of shepherding the country through COVID. And if you are not able to shepherd the country through COVID, that will reflect poorly on your administration. Joe Biden had one main job, despite other jobs. One main job. The country is dealing with COVID. Get the country through COVID. Joe Biden's idea was vaccinations would be the thing that would get us through COVID. That was the weapon that Joe Biden was going to depend on. You got to open up the economy. You got to get people back to work. You got to deal with the inflation from all of the weirdness associated with the breakages of supply lines. You got to deal with all that. But more importantly, Donald Trump got 500,000 people killed. You have to not do that. And to just not only not do that, but get to the point where COVID is in a rear view mirror, or is something that is so minimal and so minor that the public has basically gotten back to some level of normality. And whereas it looked like within the first few months that was the direction that things were going, that was the pace of events. And you could see that with the rising rates of vaccinations, Joe Biden hitting his numbers on vaccinations and everything else. Things look great. Things look lovely. That's not where we are today. Joe Biden is not going to tell you what I just told you. That his goal is to, yes, deal with the vaccinations. The vaccinations is his weapon. Open up all of that stuff. He will tell you that part. What he won't tell you is this has failed from a standpoint of messaging, from a standpoint of expectation, from a standpoint of trying to get something accomplished. This, at the very least at this point, has failed. There's all sorts of evidence of that. The numbers in and of itself are evidence of that, meaning the fact that the numbers are going up. If the numbers are going down, then that's evidence of success. The fact that the numbers are going up is evidence of failure. The numbers that are going up, deaths typically follow increases in regards to rates. And yes, we've gotten better at hospitalizations of hospitals dealing with this stuff and everything else. But the catch is we're getting new variants. The unvaccinated population are basically being Petri dishes. You don't believe me? When we're looking at the United States, just to go through the numbers, and you can look at it for yourself. Whatever anybody is telling you of COVID, the vaccines, and everything else, truth is in the numbers. 98 to 99% of the people that are being hospitalized and dying with COVID have not been vaccinated. They are the unvaccinated. Petri dishes. 98 to 99% of the people that are being hospitalized and that are dropping dead from COVID are the unvaccinated. In Alabama, 96.2% of the deaths, unvaccinated. In Maryland, 100% of the deaths, unvaccinated. 95% of the new COVID cases, unvaccinated. In Louisiana, 95% of the deaths and cases, unvaccinated. In Los Angeles County, 99% of the hospitalizations and cases, unvaccinated. The point that I'm trying to make to you is that if 99% of the people that are walking into the hospital or that are dropping dead or that are being infected from COVID are the people that are unvaccinated, then it is the unvaccinated that are Petri dishes. Yes, 1% of the people in the U.S. are catching it, depending upon where you are, of course. But think about that, 1% compared to 99%. That means that those people are basically Petri dishes. The variants and everything else that are being spawned will most likely, from all cases of probability, come from the people that are unvaccinated. Meaning, yes, you have your individual liberty to not get a vaccine. And there are different vaccines other than the mRNA. That's just one. You have every right in the world to say, I am an individual, I don't have to do it. What about my individual liberty to not be infected with a virus because you didn't have due diligence to not get infected with a virus? Meaning the fact that you're getting infected screws with any immunity that I come up with from the fact that I've got a vaccine. You are making everybody else's life miserable, and you are basically killing people. I don't necessarily care why. Meaning I don't care about your reason why. And the reason I don't care about your reason why is because you don't give a shit about my life or anybody else's life for them to give a shit why. Now, the Biden administration, however, is in a different place. They do need to care. They do need to figure out why people aren't getting vaccines, why people aren't doing due diligence. They got to figure out all that stuff. Because whatever they came up with from their original premise when they first took office, that premise has found itself to be lacking. Right here, Jen Psaki is in a weird spot trying to answer this.
But they should.
And her answer, I suppose, is perfectly fine. I mean, the answer leaves a lot of stuff out. Hey, why are you guys changing your guidance? What do you have to say to the American public who's getting whiplash? They're changing the guidance because they got it wrong. Whatever they came in as a plan and as a playbook, they got it wrong. They looked at 600,000 people dead and they thought, there is no way people are going to push back against either the vaccinations. There's no way they're going to push back against whatever that needs to be done here in order to get us past COVID. There's no wrong. 1,000% wrong. Whatever you did, whatever you thought your messaging was, whatever you thought was going to take place when you got into this administration and you were going to push through this vaccination program, the fact that Jen Psaki is here making this case, a case, by the way, that no president wants to make. No president wants to say, we're going to open up the economy. We're going to let people go through. We're going to have people with the vaccinations and everything else, and then have to turn around and explain this.
Today, they're changing their guidance. They're changing their advice to the American public, their public health advice, based on evolving data and an evolving historic guidance. That virus. That's exactly.
Based on an evolving data and evolving virus, yes. But the CDC is not changing their guidance for shits and giggles. They're not changing their guidance because they want to change their guidance. They're changing their guidance because the administration that is in office, your administration, was not able to crack the code. You weren't able to figure out how to shepherd the country through the COVID crisis without it getting to the point of either alternate variants or people not being, let's say, vaccinated to levels that would prevent the spread of the virus going forward. Yes, there was always the potential for variants. Everybody knew that. And yes, there was always the potential for, let's say, things to get out of hand. But the thought and the presumption coming in was that if you hit 70% vaccination rates, that the variants and everything else become less of an issue. Yes, they can always come from other countries and everything else, but the assumption was that the country would be able to hit the numbers necessary to prevent the stuff. And the catch is, that was found lacking. You weren't able to hit the numbers. And because you weren't able to hit the numbers, you had a huge spike in the number of cases of COVID. Because you had a huge spike in the number of cases of COVID, the CDC had to adjust their guidance saying, look, what we said about the mask thing before, not so much. We need people that are vaccinated to continue to wear masks in areas that have a huge number of people where there's a high propensity or chance or likelihood for people to be walking around with COVID. They don't want to make that mask guidance change. And yet, here we are. Let's take you back. I'm going to let Psaki finish her point. But basically, why are you changing your guidance? Or why is the CDC changing their guidance?
Today, they're changing their guidance. They're changing their advice to the American public, their public health advice, based on evolving data and an evolving historic guidance. That virus. That's exactly what they should be doing.
What is your message to Americans who are feeling whiplash right now? Why should they trust the same group of health officials who just 2 months ago told them they don't have to wear a mask anymore inside?
Because our goal is to save their lives. And our responsibility and the responsibility of public health officials is to continue to provide updated guidance. Today,
yes, your goal and your job is to save their lives. That is true. And look, science is one of those evolving things that when things change or your environment changes, you have to accommodate the changes to the environment. There's no point in keeping your head in the ground as if what just took place hadn't taken place. So there's that also. But I think the crux of this is that what she can't say is we failed. We got it wrong. We had certain ideas about what we were going to be able to do, certain game plan about dealing with COVID that shown itself to be false. We were able to get 49% of the public vaccinated. That is not enough to have this herd vaccination that we need in order to prevent the spread of COVID and to go about our life and to go about our day with the public being relatively safe, with this being in our rear view. We got it wrong. Whether that's messaging, whether that's our understanding of the virus, whatever that is, we got it wrong. That's what Psaki wants to say and can't say. Our game plan needs to change. We need to come up with a new game plan in order to deal with this virus. Part of that, honestly, and I have to be honest, I have a certain degree of animosity towards those outlets and organizations that have been safe spaces for people who've basically been against either the mask, against the distancing, against the vaccines, and been against the stuff all along. Not just now, but all along. It's unfortunate. You have a lot of organizations that are going to get a lot of people killed. You got a lot of people that are going to drop dead for being, I'm not going to say, well, for being wrong. For being wrong. And yes, I know that there are people who are totally in their mindset and feelings about either, I don't know, science, either, or about, disbelieving this stuff. And I don't even entirely blame them for it. Because the fact is, the government either has lied for so long, and it has created the situation where there's this kind of doubt and disbelief in the things that it says when it says do X or to do Y. But in this situation, a lot of people have died. Right here. And even the vaccinated can get infected, bro. The unvaccinated are not the Petri dishes. The only Petri dishes. I didn't say that. I said 99% of the people that are being hospitalized or that are dropping dead from COVID are unvaccinated. Flat fact. And whether you want to say that number is 95%, because it depends on where you are, right? There's some places where it was 96%. But it's somewhat of a moot point. If 98% of the people that are being infected with COVID are unvaccinated, then yes, the Petri dishes are the unvaccinated. Flat fact, at least to the tune of 99%. I don't know what that number is, 22 times, 23 times, or some insane amount. So yes, I'm perfectly okay with staying on that. Look, I'll end this here because I don't want this to go too long. I'm going to say like, I'm going to say share, and subscribe. Thanks all.